Cumulative cruelty, society's blindness, and men's violence. Why? Because I'm a woman? Homicide is legally defined as one person causing the death of another. However, this definition fails to acknowledge the systemic inequality and gendered power dynamics that often underlie violence against women. Not all definitions of femicide are the same. Some researchers use the broadest definition, all killings of women regardless of circumstances. And others argue that women's death must be tracked separately because women are disproportionately killed by partners, family, or in context of oppression. Scholars and institutions such as the UNODC and the UN Women adopt more specific definitions, limiting femicide to cases where the victim's gender is causally relevant to the killings. Under this narrow definition, femicide refers to gender-motivated killing of women and girls, most commonly by intimate partners, family members, or in situations characterized by misogyny, sexual exploitation, or other forms of gender-based oppression. The UN statistical framework identifies 8 criteria that signal a killing as femicide: previous record of harassment or violence, illegal deprivation of liberty, use of force and/or mutilation, body disposed of in public space, hate crime, preceding sexual violence, victims' involvement in the sex industry, or victimization through illegal exploitation. This means that not every homicide of a woman qualifies as femicide, but killings linked to gender power, control, or structural inequality do. Distinguishing between these categories matters because intimate partner killings, prostitution-related killings, and killings rooted in misogyny all arise from gendered systems of domination, not from random interpersonal violence. When these underlying structures shape the risk of death, the term femicide is justified. It signals that women are not simply victims of crime, but victims of gender social arrangements that make their lives more vulnerable. Understanding femicide in this more precise way allows us to see it is not as an isolated act, but as a combination of existing patterns of inequality, poverty, cultural norms, institutional failure, and patriarchal structures that constrain women's safety and opportunities. In this sense, femicide becomes a social and political problem rather than merely a criminal one. Yale School of Medicine's discussion for Social and Emotional Learning, SEL, highlights the value of education in building empathy, improving relationships, and fostering responsible decision-making. However, education alone cannot eliminate culturally embedded violence. It must be paired with accountability, structural reform, and systemic recognition that femicide is a public issue, not a private tragedy. Both femicide and poverty-driven prostitution arise from the same overreaching system of structural inequality that render women economically dependent and socially subordinate to men. The main claim here is that these interconnected phenomena are the result of a matrix of oppression in which patriarchal structures manifest as economic barriers such as sexism, unequal pay, and classism. These barriers disproportionately force women, especially women of color, into high-risk environments such as prostitution. Sources concur that street prostitution is intrinsically linked to poverty and emerges from a 3-pronged oppressive infrastructure of racism, classism, and sexism. Structural failures such as the refusal to pay a living wage and persistent unequal salaries compel financially vulnerable women into sex trade as a means of survival. This economic vulnerability exposes marginalized women as heightened risks of physical and gender-based abuse, including violence, rape, criminalization, beatings, and death, thereby increasing their susceptibility to gender-related killings. Ultimately, both femicide and poverty-driven prostitution are distinct outcomes arising from the same systemic failures across economic and social domains. This connection, as highlighted in Monroe's discussion of prostitution, demonstrates how unequal power relations rooted in structural inequalities perpetuate male dominance and the subordination of women based on sex, race, or class. Globally, approximately 50,000 women were victims of femicide in 2024 under registered cases worldwide, equating to an average of 137 lives being violently taken per day. This staggering figure can be compared to the global maternal mortality rate, which also claims tens of thousands of lives each year, emphasizing the severity of femicide as a comparable public health crisis. The division between homicide and femicide is 11.6% male victims compared to 60% female victims killed by an intimate partner or other family members. Understanding the influence of outside factors that contribute to femicide, it is crucial to consider regional contexts. Africa stands out as a region with the most cases, numbering 22,600 in 2024. This high count can be attributed to the factors such as the colonial legacy that has left deep-rooted socioeconomic imbalances, ongoing conflict zones that exacerbate instability, and differences in data collection that make it challenging to capture the full scope of the problem. Asia follows with 17,400 cases, and then the Americas with 7,700, along with Europe and Oceania. To understand these global patterns, research conducted in Africa, particularly South Africa, provides critical insight into how structural inequality drives femicide in the span of 2 decades. Naima Abrahams conducted 4 nationally representative mortuary-based surveys between 1999 and 2020 or 2021. The study shows that South Africa's intimate partner femicide rate reached 5.5 per 100,000 women, almost 5 times the global average. While femicide initially declined between 1999 and 2009, progress stalled thereafter. An intimate partner femicide significantly increased during the first year of COVID-19 pandemic. Even though non-intimate partner femicides did not, the authors linked the increase to pandemic-related economic stress, lockdown conditions, disrupted support systems, and alcohol access, all of which intensified the risks of women in abusive relationships. Some might argue that because more men than women die each year, especially in countries like the United States, femicide should not be treated as a distinct or urgent issue. While this perspective draws attention to overall mortality rates, it fails to consider the qualitative differences in the nature of these deaths. For example, male victims of homicide frequently die at the hands of strangers or acquaintances, and their deaths often lack a clear gender-based motive. Research conducted by Harvard T.H. Chan demonstrates the male life expectancy is affected by a range of factors, including diseases, drug overdose, the pandemic, and homicide. But these homicide incidents are rarely linked to the men's gender. In contrast, female victims of homicide are frequently killed by individuals they know intimately, such as partners or family members, in circumstances deeply connected to gender power dynamics. According to studies conducted by Amartya in 1990, data shows that in many countries such as India, women were significantly underrepresented in the population compared to men, not due to biology, but because of social neglect, which includes receiving less food, less medical care, consequence in being part of a large percentage of high child-infant mortality, being hidden secret babies are not reported, and even just because of their gender, as they are not preferred as a child in the family due to preferences for a son. And discrimination made them more vulnerable, illustrating that women are systemically disadvantaged. This points to a broader pattern in which violence against women is not a random occurrence, but a manifestation of structural power imbalances, control, and misogyny. Thus, the question is not merely quantitative, who dies more, but qualitative, the distinct gender risks women face because of embedded systems of inequality. What distinguishes femicide is not solely the act of killing, but the persistent and systemic condition that render women vulnerable based on their gender. Recognizing this social meaning underscores why femicide requires its own analytical category and policy response, distinguishing it as an urgent issue irrespective of general homicide statistics. This divergence strongly suggests that external stressors, rather than general crime trends, play a decisive role. The study further reveals how firearm availability magnified lethality, with firearm-related intimate partners femicides nearly doubling between 2017 and 2020-2021, coinciding with poor enforcement of gun control legislation. Beyond economic and policy failures, the research exposes major institutional breakdowns. By 2020 or 2021, only 1 in 5 intimate partner femicide cases resulted in a conviction, reflecting deep weaknesses in policing and justice system. Together, these findings show that femicide in Africa is not simply the result of an individual violence, but a consequence of structural inequality, economic pressure, public health crisis, firearm access, and state failure. This makes the source especially valuable for arguing that femicide is a preventable public health and human rights crisis driven by social and economic conditions. Another study by Amy E. Bonomi examines the relationship between neighborhood-level income and intimate partner violence, IPV, finding a significant correlation between higher IPV and lower-income neighborhoods. First-time police reported IPV rates in Seattle are 13 5.8 per 1,000 women in the lowest income quartile, compared to just 5 per 1,000 in the highest income quartile. This finding aligns with other found literature proving that structural factors such as poverty, low education, and unemployment have a correlation with creating environments that are more likely to host violence against women. However, the study also highlights that repeat abuse is less influenced by the neighborhood income, but rather the characteristics of the initial abuse event, especially when involving a weapon. Women exposed to weapons during the abuse incident were 72% to 83% more likely to experience repeated abuse over a 2-year period. This information together shows how poverty and neighborhood disadvantage increases the baseline risk for violence and the severity of such, as it strongly determines the escalation and risks of femicide. Structural factors such as economic pressure, social inequality, and lack of community resources create a high-risk environment for IPV. Additionally, proximate risk factors like access to weapons, perpetrator of substance abuse, or victim's pregnancy, as identified in the study as predictors of IPV and femicide, can determine whether the abuse escalates to fatal outcomes. This research supports the argument of economic deprivation and weak neighborhood structures heightening the risk of violence against women, but individual-level risks, like the weapons factor, must also be addressed to prevent escalation and related femicide. In Africa, where poverty is a big issue and social resources are limited, the combination of structural and individual risks are likely a factor that contributes to femicide cases, illustrating how structural causes like socioeconomic pressures produce and exacerbate gender-based violence. In conclusion, femicide is rooted not only in misogynistic attitudes, but also in inadequate regulation and protection for women against structural causes, leading to environments where women's safety is systemically compromised. To address this, increasing a regulation of weapon access is necessary to reduce the severity of violent incidents and potentially prevent deaths in abusive households. Building on Monroe's framework, both short and long-term interventions are essential. In the short term, reforms to welfare and anti-poverty programs, improved access to mental health services, housing, childcare, medical support for women in abusive environments, and enhanced monitoring of domestic abuse suspects can offer immediate protection. Long-term measures should address structural inequalities through narrowing the pay gap, correcting unjust systems and stereotypes that perpetuate economic inequality, imposing strict penalties and legal actions against discriminatory practices, and incorporating education about femicide and its structural roots early in life. Early exposure to this education is critical as it helps shape values and challenge stereotypes at their source. Additionally, multi-sector collaborations such as union advocacy for equal pay and faith groups working to change social norms help share responsibility for meaningful change. Ultimately, analytical attention to both immediate interventions and deep-rooted structural reforms demonstrate that reducing femicide requires multi-layered action and public recognition of the issue's complexity. Such efforts are essential not only for saving lives, but fostering a society where women and girls can exist free from the persistent threat of gender-based violence. Although these policy solutions that could serve as an unconditional welfare safety net, welfare support, accessible housing, childcare, and protective services are essential for reducing women's vulnerability, they are not only practical interventions. They are also ethical obligations. If structural inequality and economic dependency trap women in abusive environments, then society carries responsibility for ensuring that women have the unconditional resources needed to live safely. An unconditional welfare safety net is not simply a social program. It is a moral commitment to protect those most vulnerable to violence, exploitation, and coercive control. When the ability to escape abuse depends on financial survival, the absence of guaranteed support becomes an ethical failure that contributes to femicide. Therefore, providing unconditional welfare must be understood as a matter of justice and human rights, not merely as a policy of choice.